Historically, people have been very good at building infrastructure, but not very good at maintaining infrastructure. Commonly, 1 in 4 rural water points is not working anywhere in Africa and Asia. And then people don't have access to drinking water and they have to go to distant, often more dirty and often more expensive alternatives.
Urban water, we have a service provider. But rural area, there is no service provider after construction. Government said there is no investment for the operation and maintenance funding. Is solely dependent on the user's responsibility. So there is a challenge how to have the professional service provider in rural context.
What we were trying to set up was what we call professional service delivery models. So an organization that's responsible for making sure the water's in the tap, when you need it, sufficient quality, etc. And they're paid or rewarded on delivering those services. I think there's a general myth that rural water can be profitable. And that assumes that the users will pay enough in their bills or their tariffs that there's a surplus. Even in urban areas where you've got high levels of education, high levels of income, you've still got this massive subsidy that exists. So in rural areas, they're fragmented, remote populations where pipe systems are often more expensive to come in. So the costs of delivery tend to be a lot higher, and the people don't have sufficient income for that. So you have to be realistic and see there's a subsidy challenge.
Traditionally, people are used to getting free water. If we make sure that people start paying some water charge, then it'll pinch them if the water doesn't come. Then they can demand accountability that we are paying for water and why is it not coming?
Then you need a subsidy to pick up the rest of it. But the analysis that we have suggests that this is less than $1 per person per year. It doesn't cost a lot to do it. Once you have these professional service delivery models set up, you can actually deliver a very high quality service.
Share is a social enterprise. We sell consumer goods, such as beverages, snacks, personal care products, and then we do a 1-for-1 match. So if you buy a bottle of water from Share, for example, 1 day of clean drinking water gets provided to people in need. We are promising results to our customers, and therefore having a contract that is also based on results obviously makes it very seamless. We know what we're expecting from our partners, it's very clear, and it makes it easily traceable.
It de-risks it for donors or corporates who are sort of investing in this now as well. They can see the value, they can see people are paying for the water, they can see the results, and then that releases the funding into it.
We need strong contracts which incorporate result-based incentives, which incorporate outcomes, and the payments are made against those outcomes. So we find that this relationship that we have entered into with Oxford University is very useful because we are busy in day-to-day operations. We do not have time to sit back and look at the evidence.
It helped for the informed decision making because we know the information, then we can replicate that in our program implementation. We also co-designed the water safety plan for a healthcare facility. We co-designed with the Oxford REACH project. So they are giving a solution.
This is good value for money. These systems keep working, we can see the outcome. So that's setting up a model for schools and health clinics in the rural areas, which we hope, if all goes well, they can scale up nationally to 150,000 schools and 40 million children.